Hi, my name is Eric. I'll be doing a spinal assessment on my volunteer Javier. First, we're going to be examining his posture from a posterior view. His lumbar spine starts off in line with the plumb line. As you can see, when you follow up the spinous processes into his thoracic spine, it deviates to the right. Since the convexity of the curve faces the right side, you'd call this a right scoliotic curve. From an anterior view, his lumbar spine seems to tilt to his right and his thoracic spine seems to curve back to the left in an attempt to straighten back out. Also, his head seems to be pretty much in line with the plumb line, so you can tell that any kind of deviation from his posture that's present is present in the lumbar and thoracic spine. Next, we'll be assessing active trunk flexion. In order to do this, I've marked our landmarks at S2, found by palpating your PSIS and marking the midpoint. We also find the C7 vertebrae, and we mark that as well. You put 0 centimeter mark on a tape measure on the S2 mark. You then use the tape measure and follow up his spine until you reach the C7 mark, and we reach a value of 49 centimeters. Now please bend forward as far as you can. Using those same landmarks with 0 centimeters at S2, you go forward to C7 and you get 62 centimeters. That gives us a difference of 13 centimeters, and normal is 10 centimeters. Next, we're going to be examining lateral flexion of the trunk. To do this, we're going to ask Javier to stand in a neutral position with relaxed posture. And if you could, put your hands down at your sides. And I mark where he can reach to. Now, Javier, if you could, please bend to your left, keeping your hand along your leg. And at the end of that, I'm going to mark where you reach now. Okay? Thank you. Stand up straight. Now we can take a tape measure, measure the distance from the initial mark to the final mark, and we get a distance of 25 centimeters. The normal value for lateral flexion is 22 centimeters. Next, we'll be examining the strength of the rectus abdominis muscle, primary trunk flexor. In order to get a grade of 0, he would not be able to contract his muscles at all. In order to get a grade of 1, you would be able to palpate a contraction in the rectus abdominis, but no movement would occur. For a grade of 2 out of 5, he would be able to do a sit-up, but only clear C7, if you could perform that. A 3 out of 5 would be in this position if you could sit up and clear the inferior angles of both scapula. Right there. If you could cross your arms over your chest. If you can perform this sit-up and clear both inferior angles, this will be a 4 out of 5. Come down. And if you can place his hands at his head, perform sit-up, and clear both inferior angles, that's a 5 out of 5. Next, we'll be testing the strength of your erector spinae groups. These are responsible for trunk extension. Stabilization points are going to be his hips. We do this by placing a belt around his hips and around the table. The therapist also needs to stabilize his legs just proximal to his ankles. A grade of 0 out of 5 would be if he was unable to produce any contraction in his erector spinae muscle groups. A grade of 1 out of 5 would be if he were to be able to produce contraction but no movement were to occur. A grade of 2 out of 5 would be given if he was in this position but could only clear the upper part of his sternum off the table. Thank you. A grade of 3 out of 5 would be given if he places his hands behind his back and he is only able to go through partial range of motion, not quite clearing the xiphoid process of the sternum. Okay? A grade of 4 out of 5 would be given if he could clear the xiphoid process off the table in this position. A grade of 5 out of 5 is given if he places his hands behind his head and is able to clear the xiphoid process off the table.